How do you think about wearables and sort of there's a ton of technology that's historically been in this wellness space, and there is a bit of a brick wall between that and the healthcare space. And just like the pandemic accelerated the acceptance of Zoom for telemedicine and sort of new ways of accessing care, I think there's been a convergence of these spaces colliding. Maybe even going back to 2 years ago when you were a practicing cardiologist, how do you think about the role that wearables play, and how should patients who have all this data about themselves bring that to a doctor when the doctor doesn't yet understand what a wearable is and what to do with that data?
Yeah. So you're really hitting the nail on the head with the challenge, which is I think wearables are, in fact, the only way we are going to achieve population health goals. We can't achieve population health without the use of wearables. And I say that fully biased as a cardiologist, knowing that cardiometabolic risk factors are, in fact, our largest driver of longevity. And this is what I was talking about earlier today in my TED Talk. In order for us to do that, we need to really partner with our patients. And we can't be paternalistic or maternalistic anymore, right? It's a partnership. And the phrase I used earlier today is it's not consumerism, it's patient agency. And it's really my job and my colleagues' job to teach our clinicians that and to get them to accept that culture change, because the level of science that you create here at Whoop, that other wearables create, it's real science. And I think there's sometimes I call it a wall, sometimes I just call it a gap. There's a gap between medical remote monitoring that's getting closer and closer to the patient in the community. And there's a rise of wearables being just technically more and more exquisite, such that the only thing left to bridge those two is some form of infrastructure to help the wearable data get into what we consider the medical field spectrum world. I think some of the novel AI algorithms generated is going to help us pull said data together with your electronic health record data or with other things to start being really one ecosystem. I think we're on the verge of it. So if you ask me this question in 3 years, I sincerely hope we're going to be there. Because again, I don't think we can achieve population health without the active and broad use of wearables for our patients.
I love that you said that. Obviously, very aligned with that. That's why I've been here for 13 years. I think one thing that I found very frustrating for a really long time was I would want to talk to my doctors about my Whoop data and they wouldn't be receptive. And I think you are very much on the bleeding edge of being excited about this data and also taking the time to understand how to make sense of it. For our listeners who are on wearables and maybe trying to bring that in and their doctors aren't as caught up, do you have any advice for them on how to feel heard in all of that and also just how to think about it? Because, the wearables aren't saying this is your diagnosis, go have this conversation. It's often more subtle things like, here's definitive proof that your sleep is getting worse, but I don't really know what that means or what I'm supposed to do about it. Or, my resting heart rate's been creeping up for the past 3 years. Should I care about that? Those kind of moments where there isn't a diagnosis behind that, but there is maybe something that's noteworthy.
Addressing. Yeah, that's worth addressing. I would say for a moment, put yourself in the average clinician's shoes today. The majority of this country is still based in fee-for-service, if you will, and not value-based care. I hope that will continue to change, but it's going at a slow pace just because we're a capitalistic market. The amount of time your doctor has to spend with you is shrinking, or your nurse, and it's not because they don't want to spend time with you. It's because they are being asked to do more with less. Hospital margins are decreasing, clinical practices are closing, secondary hospitals are struggling. So just remember that there's a lot of forces that make them not necessarily able to spend the time with you that they want. Now, with that in mind, you likely have one or two things that they really want to make sure to check with you. And you may have the same or different things in mind. And so what I like doing is really messaging your doctor, not with, here's 100 sheets of my printouts of what I see, right? Here are all the graphs, read them. Because that's overwhelming. We're not sure what to do with it. And it's a little bit scary if you're legally responsible now for 100 sheets of something in which something may exist, right? And now it's been given to you. But rather, if you could be really concise. I know you probably have things that you want to go over with me at our upcoming annual visit. The two things I've been focusing on are my sleep and blank, right? I do have some wearables that I use, And they are finding the following for me. I'd love if there were a moment for me to talk to you or someone on your team about that when I come in. Now that's you recognizing, hey, I want to be a partner in this. I know what my goals are. This is what's happening. And it's not like, oh my God, my sleep is awful according to this. Tell me what to do. That is a very long conversation. But if it is a focused conversation, or I've already tried the following things. I'm already trying magnesium before, right? Whatever the running thing is, right? Say that you're using it so that they know what you're already kind of doing. And I think that will probably get you a better reception from your clinician during that visit. And then the other thing I'll say is give your clinician a bit of a break if they look super harried, like they're running around all day. Like that may not be the day. It may be, hey, doc, I wanted to talk to you about my, wearables, but maybe I'll just follow up with you about that in a couple weeks. Or, can I see someone on your team who does this? Remember, it's a partnership, but they're also, they want to help. If you can give them guidance right now, that would be great. It's not true for everybody. I'm talking about the somewhat reluctant, busy clinician. Many clinicians are more than happy to take your information, but they'll tell you the same thing. Don't throw 100 papers at me. If you could somehow help me with this process and coalesce some of it for me, that would be great.
Yeah, I think that's great advice. And I think sort of the meaty takeaway for people is to help the doctor understand what your actual concern is and to go a level deeper than just my Whoop sleep scores are lower, but like how is that actually manifesting for you?
I love that, the symptoms. That's right, Emily. And I will say, Whoop is a leader in wearables. And so a lot of other companies out there are looking up to you.
I appreciate that call out. And actually, a fun personal story is my stepfather has AFib. He got a Whoop when the new MG product came out back in May because we have an ECG. And last time he went into AFib, he used it. He took an ECG and there's an export like PDF that you can send the ECG trace to your clinician. And so without going in for an emergency visit, he was able to say, I have this ECG, here's what I'm feeling, and then kind of get to the follow-up kind of more interventional care a lot faster. And so it was really cool to see that because my team worked on that for about 3 years. And then all of a sudden it was like very close to home. And so as we get closer and closer to health as opposed to just wellness, and that ECG feature is an FDA cleared feature, so something that we partnered not you and I directly, but the FDA and Whoop to bring to market. We were really thinking about how do we not just leave you with a sort of fun fact you have AFib, but actually help you transfer to care, because Whoop isn't going to treat your AFib.
That's right.
But the idea is to bring that awareness.
I mean, that is, so first of all, congratulations to you and your team, because that is a feat. The second is, yes, with the FDA-approved technologies, I think there is such an opportunity to really help the clinicians. Your CEO, Will, and I were talking about this the other day. In that pyramid I talked about earlier, the middle of that pyramid of healthcare is the rising risk population. And that's where these FDA-approved wearable technologies can really help us identify somebody in their daily life, wherever they are in the community, and get them to the right care sooner. And that's really what we're trying to do. And so again, when I say we need it for population health, that's a perfect example of how we can actually enact a care pathway based on the alert of a wearable.